Hi, I'm Mark Friedman, chairman of the Midsize Retirement and Healthcare Plan Management Conferences. I have with us today one of our plan sponsors who speaks for us, runs some of the most popular workshops that we have time and time again at our conferences, Dave Peterson. Dave, what are some of the takeaways from your session that you let the people that attend walk away with?
Sure. I think what participants will not see in our session is a lot of talk of healthcare reform and exchanges. This session will talk about and provide a checklist of a variety of different programs that companies, regardless of what industry or geography that they're in, will add greater value to the overall benefits program to help attract and retain key talent.
How often do you see people today actually caring about attracting and retaining talent? During the recession, we heard our benefits programs aren't needed. There's lots of employees out there. We're back in a little tighter employment environment, but there's still a lot of unemployment out there, and benefits are much more expensive than they used to be. Do employers still see the value of these plans as being a retention and attraction tool?
Sure, it's certainly a component of it. Employee engagement, retaining key talent, particularly, is hardcore to our business at Hologic. And across a lot of technology-based companies. We try to be as strategic as we can regarding compensation plans and benefit plans to leverage all that we can out of those programs that are really, really expensive to my organization and really any organization.
And how hard has the job become today, especially in the healthcare arena, with the high costs, justifying those costs? You have a conversation with the CFO in your organization, the CEO, and they say, slash these costs. You hear stories from a lot of plan sponsors. What do they say?
Sure. So I had that exact same conversation about 3 weeks ago. We walked in with a preliminary proposal to our CEO and said, sounds good. I'm supportive of your program and your strategy and philosophy, but cut more. So we had to be creative and work very closely with our vendors and our brokers and advisors to examine multiple options for plan design and program changes. And we went back and provided him with multiple alternatives, and we ended up meeting in the middle. Not quite as low as what he wanted, but we ended up in a place that we feel very comfortable with. And it will require more communication, more education, more awareness than we had originally thought about, but we factor that into the program and into the cost of structure of the new program.
Could you give some tips to our audience about how you deal with employees when you have to come to them and say, we've had to cut these benefits, or your costs are going to go up, you're going to be required to have a bigger share of these costs, without getting them completely disgruntled and unmotivated?
Sure. When we do education sessions for our benefit programs, we try to touch all audiences, all East Coast, West Coast, everywhere in between in a variety of different manners. And we always start with the strategic philosophy around the program, as well as the challenges of balancing a few different factors, balancing the complexities of a multi-generational, multi-geographical workforce, the complexities of balancing competitiveness, which varies. Offering competitive programs to employees is a challenge and something we're always evaluating. We also look at, obviously, cost. Cost could be the first, it could be the last, and we really try to educate them around these are 3 factors, but 4 or 5 different factors to get them all on a level plane before we get into more concrete details around program design for the new plan year.
Right, I'm going to ask you a loaded question, and you don't have to respond to this with just experience from your company, but plan sponsors that you talk to around the country. Do employees, participants, for the most part, still see their health care programs and their retirement care programs as a benefit, or do they just see it as an entitlement? And the flip side of that, does the C-suite within organizations see these programs that they're offering, which cost an incredible amount of money, as a benefit for their employees anymore, or is it something that they just feel they have to offer?
I've been very fortunate. I think the CEOs that I've worked for the last 5 to 10 years have very much embraced the value of benefits for employees, attracting and retaining talent, and doing what's right for people. You do what's right for people. Hopefully that leads to healthy people, which hopefully leads to more productive people. So I've been very fortunate. Not all companies can say that. When it comes to employees, again, the organizations that I've been at, it's a multi-year approach. We try to carve away each year, chip away at it. I've been at organizations that feel it's an entitlement that I should get these things every year and I should get quality benefits. And I think it's our responsibility to again strike the balance of educating and informing them around the details behind what goes into these programs. At the same time, you want to motivate them and not distract them from doing their day job.
All right, Dave, thank you. I appreciate your perspective, and I know our attendees appreciate that very much.
My pleasure.
We thank you for all you do for us.
Thank you. My pleasure.